Hello everyone and welcome to our training video. This is to show nurses how to transfer from one ward to another when you get a telephone order using level of care. So what we're going to do is we're going to choose our patient and we're going to go to order entry. In order entry, level of care is located at the top menu and it's signified by a pill and the wording's level of care next to it. Before we go into the level of care application, we're going to make sure that our properties are set correctly. We're going to set our order option to telephone. Our ordering physician should be set to whatever the physician's name is that gave us the telephone order. For my example, I'm going to use our test doctor, Dr. Pax. He gave me my telephone orders for this transfer. Now we're going to go into the level of care application. In the level of care application, you're going to see two windows, active orders and what looks to be our order basket. This is what level of care looks like. In the active orders, this is all the orders that the patient currently has that is active for them. And you can scroll through them to see all the orders. So how do you transfer these orders from one level of care to another? We're going to go ahead and select all the pharmacy orders. Let's say I got the order to continue all medications. So I'm going to go ahead and pick this blank square box next to pharmacy and I'm going to click it. You're going to notice all the medications that fall under pharmacy have been selected. The next thing you're going to do is you're going to click the reorder button. You're going to notice that the medications have now moved into my order basket. In order to complete level of care, we have to make sure to reconcile all of the orders in the active order window. As you can see right now, my circle with a check mark, which we usually use to send our orders, is gray. Once we reconcile all the orders in the active orders window, it's going to turn green. So let's say I got the order to continue vital signs per protocol at the next level of care. Continue the code status. Strict IN no and daily weights. So I'm going to go ahead and select all of those and click reorder. You may get a pop-up from these orders and what it's asking you is to set the scheduled date and time. So the computer or the system doesn't know when you are going to transfer this patient to the new level of care, so it wants to be told. So how we tell it is we're going to set the scheduled date and time for it. And you'll set the scheduled date and time for every single order that asks you to. Now that I'm done setting the scheduled date and time, you're going to notice that all those orders have moved into my order basket. For the rest of the orders that the physician does not want to continue to the next level of care, we're going to have to discontinue. So I'm going to select all the rest of these orders, and I'm going to go up to the top and select discontinue. You're going to notice that all those orders have moved to the order basket, but now they say discontinue. Now you're going to notice that that previously grayed out button has now turned green and it's now ready for us to send our orders. So you can go ahead and select the circle with the checkmark button to send our orders. Once your orders are done sending, you're going to get a pop-up that's called Order Reconciliation Complete. This is just telling you that those orders that you have placed is now reconciled. So we're going to go ahead and click OK. The next thing we're going to do is we're going to order for the transfer order. So now we're going to go into the physician's panel. And we can go to transfer to orders. Let's say this patient was at ICU and now I want to move this patient to telemetry. So I'm going to choose transfer to telemetry. Make sure you have all your properties set correctly, telephone order, the correct physician, and your order priority. And go ahead and select that order. Once it ends up in your order basket, we're going to go ahead and send that order. We're going to click yes on the red back orders pop-up. And that's how you would transfer your patient from one ward to another. Thank you.